Hello everybody, this is Dr. Dan Lyons with 2020 Imaging, and we are proud to debut our Pennings Analysis software module for flexion and extension film analysis. If you do PI work, workers' comp work, or sports injury management, then you are going to want to take note and watch this video, because what we have done here is made your job a lot easier. One of the more difficult aspects of managing flexion extension injuries is quantifying it. If you can't measure something, you can't really accurately manage it. And so what this has done is taken all of the legwork out of that. It will measure and quantify all the ranges of motion between all the cervical vertebrae and compare them not only to flexion to extension, or it does flexion to neutral and then neutral to extension and then the overall total, but it also will compare it to the normals. And so, as you can see here, I've already stitched my films together. You don't have to do this if you don't like to do this. Most of you are probably watching this on a regular horizontal monitor. In the office, I hang a monitor vertically, a 55-inch monitor vertically, so I stitch these together, and it just makes it a lot easier to present to the patient. And then once you have this all done, it'll print a little chart over here, so you can print that out, save it that way, and send those images to the attorneys or the any other doctors involved in the patient's care. So I'm going to blow this up here, and you can see where I placed my points there. We'll come back to that notion in a moment. And so I'm going to blow this up nice and big. So you can see over here this little P or big P icon. That is the Pennings analysis. If you don't have it in your palette, you just go up to the menu here and find it just like you find your other annotations. But you click on it, you can see this end annotation pops up there, so we know the annotation's active. If there is no annotation active, then end anno is not up there, and then you start clicking your points. So you start at the posterior superior vertebral body, the anterior superior, posterior inferior, and anterior inferior. And you just click those same four spots all the way up, 7 through 3. And we're almost done there. Now when you get to C2, you're just doing the posterior and anterior of the end plate there. C1, posterior arch, anterior tubercle, then the posterior of the dens, or the anterior of the dens and the posterior of the anterior tubercle. And then you have occiput. And so I chose these 2 points, and you can see here that flexion pops up. Flexion is the default when you do this on all the films, so flexion obviously don't have to change, but then if you hit the N on your keyboard when it's highlighted, it'll go to N, and you go to E. And so now we have them all filmed, all marked appropriately. So when it comes to occiput, I'm going to walk through this. You can pick any 2 points, hard palate, so I've tested it with using fillings in the teeth and something back here. This does not move, so you can pick any 2 points. If you crop your films so that you can see the sella turcica, you could pick these 2 points and it will still be accurate. It's a nice feature, because sometimes back here it's just tough. You don't get really clean points to use. So we've got a flexion, or an extension, a neutral, and a flexion film. So now if I come and hit this icon, calculate Pennings, and drop it, there's our chart. And then I'm going to left click to end the annotation. And so here, and this you move around just like anything else you would, you can see here's our patient's range of motion. So you've got the flexion to neutral, the neutral to extension, and the overall totals. Here you have the total range of motion, And you also have, I'm going to move this over here to the black so it's a little easier to be seen. Here you have the normal ranges of motion. From peer-reviewed journals, we have the sources attached. And then you have one standard deviation, and the asterisks are the ranges of motion that are outside of one standard deviation from the median. Gives you a percent difference if you want. A couple of attorneys asked for that. And then you have your translation down here. So you can see as you go through here, neutral looks pretty good. Look here, there's a little anterior slippage. And that one stays there. This one's dropping back. That one's dropping back. So you can see that reflected accurately there. We played with this and tested it quite a bit. We're very happy. We hope to have some more modifications and improvements to this already. We have in the design pipeline, and we hope you enjoy it. Thank you for using 2020 and watching, and I hope to speak to you all soon with new updates. Bye-bye.